What does it mean to be a doctor with a tongue and doctor with a brain? And how do they rely between knowledge and communication to treat their patients? First and foremost, doctor with brain will work for brains and nerve conditions such as neurologists and neurosurgeons. However, for doctor with tongue, we will treat people for mouth, tongues, and also speech, such as ENT specialists, dentists, and also speech therapists. Both of them rely on knowledge and also need to have a good communication skills in order for them to explain clearly to their patients about their cares and also their conditions and treatments. Do you want to know more about it? Let's go. Hi guys! Hi! Can I ask you questions? What are your opinions about doctor with a tongue and doctor with a brain?
In my opinion, I think that doctors who practice with their brain rely heavily on critical thinking, analytical skills, and evidence-based reasoning to diagnose and treat patients. I think that they engage in continuous learning, staying updated on the latest medical research and advancement. This approach involves assessing complex situations, interpreting data, and considering multiple perspectives to make informed decisions. In my opinion, I also think that doctors who practice with their brain prioritize patient safety, understanding the nuances of each case, and applying medical knowledge in a thoughtful manner. Their practice is characterized by a deep understanding of medical science, meticulous attention to detail, and a commitment to providing high-quality care. Surgeons, radiologists, clinical researchers, and so on are some examples of doctors who practice with their brain.
Wow, that is a great idea. How about your opinion, Christina?
I'm not sure what Osler even means by the phrase doctors who practice with their tongue. I don't think he is talking about the ENT specialists or oral maxillofacial surgeons. Well, I think that his intentions behind the phrase are actually related to communications. In the medical field, communication can occur between a doctor and his fellow colleagues, medical staff, and most importantly, the patients. As far as I know, patient-doctor interactions are very vital in medicine and is very much emphasized in medical school. We can see these interactions happen involving in the process of history taking, where the doctor or student should be able to listen to a patient's story and then translate it to medical terms in order to come up with a proper diagnosis. To my knowledge, the medical professions that are more involved in communication include general practitioners, consultant physicians, and psychiatrists.
Wow, that's actually a great idea. Okay, I think that's all from me. I'm going to another person. Bye-bye. Thank you guys.
Guys, I'm your next interviewer. My name is Shahir. So let's find some people. Hello guys. I would like to ask your opinion on the importance of having a doctor who practices with their tongue and a doctor who practices with their brain. So these are actually taken by quotes by William Osler. So do you guys have any opinion upon this?
Yes, I do. So first and foremost, doctors need strong analytical skills to make accurate diagnosis and to also develop effective treatment plans for the patients. They must be able to analyze patient information such as medical history, symptoms, and also test results to identify the underlying cause of their diseases. And aside from that, they require critical thinking, problem solving, and also the ability to extract relevant information from the test results. Effective communication skills are also equally as important for doctors to build trust with the patients and also to provide clear instructions. They need to be able to emphasize with the patients, to listen attentively, and to also give out clear instructions to them in a way that they understand. And this can also help doctors to collaborate with other healthcare professionals such as nurses and also other specialists to provide better healthcare practices and an overall better experience for other patients.
Okay, that's a very unique way of thinking. Let's go to the next person. So what do you think?
So I think that both types of doctors are equally important in nowadays. So let's take a look at the first one, which is doctors who use their brain primarily. So critical thinking is one of the vital aspects of being a doctor, and this is perfectly shown in the TV show Dr. House, where in one of the episodes, Dr. House encounters a patient with baffling symptoms, and through analytical reasoning, he is able to determine that the patient has a rare autoimmune disorder, and this further shows that how problem solving is able to propel a doctor to a level where patients can rest easily and go back home where they feel that they have been cured, or is able to rest assured at home. So let's take a look at the other end of the spectrum, which is effective communication. So if you watch the show Dr. House has a poor bedside manner. So this is perfectly shown in contrast to his colleague, which is Dr. Cameron, where he excels in this area. In the same episode, if I'm not mistaken, they encounter a young patient where Dr. Cameron's empathy is able to give comfort to the patient, and she is able to share his fears, providing key insights to enhance the treatment. So, in my opinion, that both types of doctors is relevant in this era and is required to treat the patient effectively.
That's very insightful. Thank you very much. So let's hear the opinion of our last interviewee.
To me, it's not just about the brains doctor who are purely focusing on intellect, might miss the human element. Doctors should also practice with their tongue in mind. Doctors that are great at reading charts and interpreting the test results, but if they can't communicate well with their patients, it could lead to misunderstanding or poor compliance with treatment, resulting in unwanted scenarios. Decent communication skills would come a long way in enhancing collaboration between healthcare workers. Great teamwork to make sure that the patient will ultimately get the greatest patient's outcome and get the best patient management they could get.
So that's the opinion of our interviewee, and that's very insightful. Thank you very much.
Hello guys, what are you guys doing right now? We're just playing with our phone. Oh, I want to ask your opinion about how does the ideal doctor balance between brain and also tongue?
The ideal doctor combines both intellectual rigor and clear communication, striking a balance between analytical thinking and conventional interaction. A doctor who practices with their brain relies on deep knowledge of medical science, diagnostic skills, and critical thinking to solve complex cases. However, without effective communication, the ability to explain conditions, empathize with patients, and collaborate with other healthcare professionals, this knowledge can remain inaccessible. A balanced approach is vital. A doctor must not only diagnose and treat, but also ensure that patients understand their conditions and feel heard. When both types of doctors work together, those excel in diagnostics and those who engage deeply with patients, they create a more holistic, patient-centered care environment, and this can lead to a better overall outcome.
Wow, this is a great idea. Thank you, Zalta. How about you, Manu?
That's a good question, Ivy. For an ideal doctor, balancing the usage of both the brain and the tongue leads to a more comprehensive approach to medicine, improving the overall patient experience and health outcomes while reinforcing the essential partnership between doctor and patient. Intellectual knowledge enables doctors to diagnose and treat medical conditions accurately. However, effective communication helps them in gathering vital information from patients, including symptoms and history that might influence health. By engaging in empathetic communication and understanding patients, doctors can ensure that they have a better picture of what the patient is actually going through. This balance is also crucial for tailoring treatment plans. An ideal doctor who listens actively can consider individual patient preferences, lifestyles, and potential barriers to compliance, which leads to more personalized care. For instance, one such specialty among doctors that requires immense balance between the brain and the tongue is psychiatry. Since this field deals with the vulnerable minds of patients, each case is unique in its own way. Psychiatrists need strong clinical skills to diagnose and treat mental health disorders, but they also rely on heavily therapeutic communication to establish trust, encourage patients to open up, and engage in effective treatment discussions.
Thank you, Manuel and Sarantov. I think that's all from me. Thank you, guys. Bye.
Okay, so we have reached the end of our interview. Let's summarize everything that we have done in our finding. So in medicine, doctors can be broadly categorized into those who rely on critical thinking and analytical skills, which is practicing with their brain. And we have also doctors who excels with their communication, which is practicing with their tongue. So doctors who practice with their brain, such as surgeons, radiologists, and clinical researchers, focus on evidence-based reasoning, diagnosing, and treating patients through data and analytical skills and medical knowledge. And on the other hand, we have doctors who practice with their tongue, which is like general practitioners, psychiatrists, which prioritize communications, particularly during patient interactions, history taking, and teamwork. Both critical thinking and communication are essentials for effective patient care. The ideal doctor balances these skills, ensuring patients not only receive accurate diagnosis and treatments, but also feel understood and supported. This balance is particularly vital in fields like psychiatry, where both intellectual and communication approaches are needed to understand and treat vulnerable patients. Okay, so let's move on to our last session, which is the FAQ. We have done several surveys, and these are the frequently asked questions. So, why is communication important in medicine? Communication helps doctors gather vital information, understand patients' perspective, and explain diagnosis and treatments in a way that improves patients' compliance and outcomes.
That's all from us. Thank you.